Here, let me explain the difference between hypo and hyperthyroidism. I will also give you some clue how to remember and how to answer the question in NCLEX board exam about hypothyroidism and hyperthyroidism. Hypothyroidism, it is the inadequate production of thyroid hormone like T3, T4 by the thyroid gland. The picture here, you can see the thyroid gland. The thyroid gland is supposed to secrete T3 and T4. But this T3, T4 supposed to be within the normal limit. If T3, T4 is too low, patient develop hypothyroidism. If T3, T4 too high, patient develop hyperthyroidism. So let me recap it. If inadequate production of thyroid hormone like T3, T4 by the thyroid gland, patient develop hypothyroidism. What are the causes of hypothyroidism? The causes we categorized the primary causes, secondary, and tertiary. The primary causes, it is the issue with thyroid glands. The most common type of primary hypothyroidism are Hashimoto disease. It is the autoimmune disorder. And if the severe hypothyroidism occurs in infant, we call cretinism. The tertiary cause of hyperthyroidism are insufficient thyroid releasing hormone. Also, some books said another cause of secondary hyperthyroidism are tumor. Anterior pituitary gland produce insufficient TSH and patient develop hypothyroidism. So if the tumor occur, anterior pituitary gland produce insufficient TSH. Due to the tumor, the cause of hypothyroidism is called secondary, and tertiary is the issue with hypothalamus in the brain. Hypothalamus produce insufficient TRH. T stands for thyroid, R for release, S for hormone. So now let me explain what are the sign and symptom of hypothyroidism. And also I will explain the treatment and nursing care. Here you see the spelling of hypothyroidism. We say HYPO, hypo. In hypothyroidism, everything is slow. And we can see the body temp, the skin or patient have a cold intolerance, the spelling is CO, hypo, right? And C3 and C4 is low. Easy way to remember. On the other hand, we can see in hyper, 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 everything is hyper, means faster. Okay, so metabolism is so fast. Metabolism is fast. T3, T4 is high. Here we can say everything slow, metabolism is slow. So let me tell you, the patient present with the most common sign and symptom of hypothyroidism here you see patient develop constipation or difficulty of speech, depression, bradycardia, brittle nail, hair loss, or dry skin. So blood pressure go down, right? Hypotension, bradycardia, less heart rate, patient feel lethargy or cold intolerance, constipation, weight gain, because metabolism is slow. If metabolism is slow, patient develop, weight gain will be, or weight will be increased. And also, they said thin hair, hair loss, brittle nail, fingernail, and also patient develop the depression. Some book explain the different way. They said if patient has a hypothyroidism, everything supposed to go down. Like T3, T4 go down, right? Metabolism will be slow, decrease the heart rate, we call bradycardia, decrease the high blood pressure, patient develop hypotension, lethargy, patient feel weak, patient is depressed, patient develop edema, intolerance to cold. Only one thing will go up, this is the body weight. On the other hand, in case of hyperthyroidism, we can see excess thyroid hormone secretion. You can see this is the picture. In this picture, the patient thyroid gland is going enlarged into the sides. Enlarged thyroid gland, sometimes we call goiter. This goiter or thyroid gland secretion excess T3, T4. So when excessive thyroid hormone T3 and T4 released from thyroid gland and resulting in hypermetabolism states, because hypermetabolism occur, patient develop hyperthyroidism. What are the causes of hyperthyroidism? As like as hypothyroidism, we categorized primary, secondary, and tertiary. The primary cause, basically issue with thyroid gland. Most common one is called Graves' disease. And Graves' disease is autoimmune disease. Sometimes patients develop thyroid nodule and causes hypersecretion of T3 and T4. When a patient has T3, T4 go up, and also the eye ball is bulging outside, enlarged eye, we call Graves' disease. Secondary issues or causes. Secondary cause issue with primary pituitary gland. Anterior pituitary gland produce too much TSH, thyroid stimulated hormone, when thickness is too much. Due to the maybe sometimes causes the tumor. Because of tumor, the pituitary gland produce too much TSH. And some are tertiary causes. Tertiary cause issue with hypothalamus. And hypothalamus produce too much TRH. TRH stands for thyroid releasing hormone that act in the anterior pituitary and secrete TSH, and TSH work on the thyroid gland and secrete T3 and T4. So now let me explain. Here, so now I'm going to show you what are the common sign and symptom. Patient develop diarrhea, insomnia, mood switching, palpitation, tachycardia, and feeling of hot or heat intolerance. The scanty menstruation, and also complication in late stage, we call thyroid storm. So tachycardia, right, increase the heart rate, and also patient develop hypertension or heat intolerance. We wrote here hot. And in this picture, you can see the eyeball is bigger. It is exophthalmos. In case of hyperthyroidism or Graves' disease, patient metabolism is go up, so body weight should be go down, opposite to hypothyroidism. Patient develop insomnia or diarrhea, and also sweaty skin. Some book explain in the different way. They said, if in case of hyperthyroidism, everything going to high, like metabolism go fast, increase the metabolism rate. Because of metabolism increase go up, means more chemical reaction, more heat production. So we call heat intolerance, right? Heart rate go up, patient develop tachycardia, blood pressure go up, hypertension, and also hyperactivities. Patient have a high energy, high metabolism, diarrhea, intolerance of heat. Most common sign and symptom of hyperthyroidism. So now question come. What are the treatment options and what are the laboratory tests? So what are the treatment options? First of all, hypothyroidism. If patient develop hypothyroidism, definitely we go for laboratory test first. We check T3, T4 and TSS. The lab result would be decrease the T3, T4 but increase the TSS in case of primary hypothyroidism. And also we will get the anemia. On the other hand, in case of hyperthyroidism, we found the lab result that increase the T3, T4, but decrease the TSS. Thyroid stimulating hormone should be decreased in primary hypothyroidism. And let me explain about the, if your patient have a hypothyroidism, what are the nursing care? We encourage the patient frequent rest period. Encourage them low calorie, high fiber diet, and increase the activity to promote the weight loss and prevent the constipation. No fiber laxatives. And provide the extra blanket because patient complain of cold intolerance. And also we will increase the room temperature, but no electrical blanket are allowed for them. So in case of hypothyroidism, we encouraging our patient to take levothyroxine, right? But in case of hyperthyroidism, patients supposed to talk PTU, but here is the levothyroxine. Easy way to remember: Hypo O and Levo O. Easy to remember. It is a close. So when you give the levothyroxine, other is called Synthroid. Always start with low doses and gradually increase the dose. And also take 1 hour before the breakfast with full glass of water. It is important to educate your patient. So levothyroxine used for hypothyroidism. This medication acts as a synthetic form of T3, T4 because hypothyroidism patient decrease the T3, T4. So you have to give something to increase the T3, T4, and levothyroxine is a synthetic form of T3, T4. When you give the levothyroxine as a healthcare provider, you should know some side effect. What are the side effects? You must know. So when the dose is too high of levothyroxine, patient chance to develop hyperthyroidism sign and symptom like anxiety, GI upset, sweating, weight loss, and heat intolerance. They are the sign of hyperthyroidism. When you give them too much levothyroxine and T3, T4 is increased too much and patient develop side effect of too much levothyroxine, what are the side effects of hyperthyroidism? Some keep note for NCLEX. So when your patient undertaking the levothyroxine, we could tell them something, and this is the keynote for NCLEX. NCLEX board asks the question. So we could monitor the T4 and TSS level, right? Thyroid stimulating level. And also educate your patient, take on empty stomach with a full glass of water and before the breakfast. And also we could educate them, this medication means levothyroxine, they have to take lifelong. What else? So now the patient who have hypothyroidism, if patient took the Synthroid or levothyroxine, chance to develop signs symptom of hyperthyroidism due to too much levothyroxine. But if any condition patient is, hypothyroidism is very severe, we call myxedema coma, right? So as I told you, if the hypothyroidism patient is untreated and very severe hypothyroidism develop, we call myxedema coma. The cause of develop the complication of hypothyroidism or myxedema coma if the hypothyroidism is untreated. Sometimes infection, illness, or suddenly or abrupt discontinue of levothyroxine, patient chance to develop myxedema coma. If your patient have a myxedema coma as a complication of hypothyroidism, you can see patient has a hypoxia, decrease the cardiac output, decrease the level of consciousness, or decrease the bradycardia, or hypotension, or hypothermia develop. So what are the nursing care? We maintain the patient airway, monitor the EKG, and also we should try to keep the patient warm. Also administer large dose of levothyroxine. So what else? Let me explain the hyperthyroidism treatment option. So here, so if our patient have a hyperthyroidism, if you go for laboratory test, we get increase the T3, T4, but decrease TSS if the primary hyperthyroidism. So what are the nursing care? In case of hyperthyroidism, nutrition is very important for your patient. So increase the patient calories and protein intake and monitor import output chart and body weight. Whereas the hypothyroidism nursing care, low calorie, high fiber diet, and increase the activity. Compared to the hyperthyroidism, increase the patient calorie, but here is a low calorie, but protein intake is increased both cases. If the hyperthyroidism patient develop the exophthalmos, means bulging the eye, enlarge the eye, bigger eye, we make sure tape the eyelid closed and provide eye lubricant. So what are the medication we're supposed to give in case of hyperthyroidism? The most common one medication is called profile thiuracil, shortly called PTU. Sometimes if patient have a high blood pressure, we give them beta blocker like propranolol. Beta blocker is good for them. Or we give them the iodine solution, Lugol solution or iodine solution. So if your patient need to the iodine solution, it mix with the juice to mask the taste. Otherwise, it is not taste good to drink. Also, some patient, if the PTU is not enough to control hyperthyroidism, we go for radioactive iodine. It is very important we could know about this. So if your patient supposed to take radioactive iodine, stay away from the children for 2 to 4 days. Educate your patient. After using the toilet, at least flush the toilet 3 times. And do not share the toothbrush or use disposable plate or the stuffs. So sometimes NCLEX board asks a common question: if my patient took PTU or profile thiuracil, so what are the indication of PTU? It is if patient has a Graves' disease, right? Means primary hyperthyroidism. Or PTU also we give in preparation for thyroidectomy. The mode of action of PTU, they blocks the synthesis of thyroid hormone T3, T4, because hyperthyroidism patient has a too much T3, T4. They blocks the release of T3, T4. But there are some side effect of PTU. Patient develop agranulocytosis or GI upset, hepatotoxicity, or if dose is too high, patient develop the sign of hypothyroidism, like opposite the levothyroxine. If you give too much PTU to your patient develop lethargy, weight gain, cold intolerance, bradycardia, or depression. So what are the keynote you have to know for your patient? So when my patient taking the PTU or profile thiuracil, what are the keynote we could know for the patient? Is the key point for NCLEX exam. So usually profile thiuracil or PTU takes 1 to 2 weeks for full effect. So take time to start the work. When a patient undertaking PTU, we could monitor the CBC, complete blood count, and liver function test, because PTU have a hepatotoxic effect. And CBC we could check for agranulocytosis. When patients take the PTU, they chance to develop WBC count go down and patient easily catch up the infection, and patient come to you with fever or any kind of complication of infection. So it is very important we could tell our patient about it. So if your patient has to take the radio medication or radioactive substance here, you see the radioactive substance, maybe a common question come to in your brain, why too much option? Because if your patient come to you first, you give them PTU. If PTU is good enough to control the disease, it is okay. But if the profile thyroid cell is not enough to control hyperthyroidism, we supposed to go other option like iodine solution, radioactive iodine, and finally thyroidectomy, and sometimes need both. So some common information we supposed to know about the thyroidectomy. Thyroidectomy means surgical remove of the thyroid glands. Okay, it is called thyroidectomy. What are the post-operative care? Tracheal set should be there. Give them oxygen, suction, and calcium gluconate at the bedside. Let me explain a little bit more. First of all, after the thyroidectomy, we could place the patient in high Fowler position and prevent hemorrhage, means bleeding, blood loss. After the surgical operation or thyroidectomy, we could check the dressing and back of the neck for bleeding. Support the patient head and neck with a pillow or sandbag. Educate your patient to avoid the neck flexion or extension. So also have the thyroidectomy supplies available at the bedside. What are the supply? Oxygen, suctioning machine, and also calcium gluconate at the bedside. So we monitored the sign of hyperthyroidism. Why? In this picture, you can see the thyroid gland, and inside the thyroid gland or behind the thyroid gland, there are two pairs of gland we call parathyroid gland. Sometimes, unfortunately, accidentally, intentionally, because of thyroidectomy, these two glands supposed to be removed, right? So we have to monitor any complication of when remove these two glands. We call sign of parathyroid gland damage. When remove these two glands, patient develop hypoparathyroidism. The parathyroid gland secrete the calcium and secrete the PTH, parath hormone, and also balance the phosphorus level. So here I said this parathyroid gland secrete the parath hormone, and also parath hormone increase the calcium secretion but decrease phosphorus secretion. On the other hand, I want to explain parath hormone maintain the calcium level and phosphorus balance. So if the thyroidectomy operation is done and this 2 gland is removed as well, we check for the sign and symptom of hypocalcemia. What are the sign and symptom of hypocalcemia? Numbness, tingling around the mouth or toes, muscle twitching, positive chopstick sign or positive trousers sign. In that case, we give them calcium gluconate. So calcium gluconate for the treatment of hypocalcemia, it should be at bedside. Also, we could administer steroid like prednisolone to decrease the post-operative edema. Now, let me explain the complication. So, the hyperthyroidism patient sometimes develop the complication we call thyroid storm, means excessively high level of thyroid hormone with the high mortality rate. It is very important. If you do not manage the thyroid storm, patient will die. The cause of thyroid storm or complication like infection, stress, or diabetic ketoacidosis. The common symptom, patient develop hypertension, chest pain, dysarrhythmia, dyspnea, and delirium. So management means control the temperature, IV fluid, electrolyte replacement, hydrocortisol, and propranolol, because to control the high blood pressure, and also the steroid can reduce the postoperative edema formation. So they said the blocks the action of thyroid hormone on the cell, thyroid storm develop. And the surgery, we said thyroidectomy means removal of thyroid glands. So patient will need to thyroid replacement therapy for rest of the life if total thyroidectomy done.